What are your thoughts about the risk of Zika virus, which is a mosquito-borne viral infection, when traveling to affected countries and trying to conceive or pregnant? This person's heard mixed opinions on how high the risk actually is versus the NHS advice of just don't travel to any country with reported cases. So Zika virus, a virus that can cause birth defects in unborn children, transmitted by mosquitoes, and it's quite widespread across the tropics. How do you think about this? Because I see a lot of patients who have traveled whilst pregnant, come back, expose themselves to Zika, and then we deal with the fallout of that.
Yes. I think it's a really difficult one to answer this. And this is very much where we'd say it's an individual thing. And I would just recommend somebody sits and talks this through, not just with one of the couple, but assuming if you are in a relationship and you're wanting to conceive or pregnant, making sure both of you are on the same page. It's one of those things that the testing for Zika is difficult. So unless you have a fever and you've been to a Zika country, we can't do a reliable test to say whether you've been exposed. So it's how do you sit with the risk, even if it's small, that something may have happened to your unborn baby. And this is why the NHS advice is quite blanket, but it's something we can really help to navigate. It's a very difficult one. It also boils down to how much do you want to or need to do that trip. So if you could go somewhere where there isn't a Zika risk, and you may get to the point when your baby is 6 months old and they're sitting up late or not meeting their milestones, and you always think, was that because I got Zika and I didn't know about it? You've got to sort of feel confident you can live with that, even if it's unlikely that that was the cause.
I think that's right, isn't it? The absolute risk is often extremely low, but the long tail of anxiety and the difficulty in having certainty then can last for years.
Yeah.
And so I think we that's why often, even in places without much Zika, if there's a risk of Zika, we say, I always think we ask people to consider not going rather than we say you shouldn't go.
And there's a lot you can do to reduce that risk if you do need to go. So if you have to go for a really important reason or you realise afterwards, there's a lot of reassurance we can do, and we can talk about bite prevention and look at rates, but we're not going to be able to give you that absolute 100% certainty. So it's how you sit with risk, I think.
And that's a lot of our consultations are talking about the risk and how that risk is going to feel when you're there.
Yeah.
And it's not telling you what to do, but it's helping you work out how you're going to feel while you're there and afterwards, and avoiding the kind of regret.